the ear canal becoming more and more sensitive the deeper the wax is accumulated. It really does take a professional, someone who's been in the ear canal a lot, to make sure you're safe, make sure that the earwax is going to be able to come out without it being way overly, damaging or hurtful or frustrating. And so it's a pretty sensitive and I think quite technical skill as far as taking wax out that is beyond the cartilage. It does take some know-how. I remember just learning to take wax out. I was very, very intimidated the first several years.
Oh yeah.
And then
in school they scare you.
It scares, and then as you go,
don't hurt their eardrum.
Yeah.
Go.
Yeah. Well, yeah. So I mean, basically, as you get into this several years, and you see more and more wax types, and you see more and more different types of conditions where the wax might be, and how to tease it out without damaging or hurting the patient. It is kind of an art, and it's extremely technical, and so. Yeah.
So how do we do it? There's 3 ways really. One way is we have gigantic medical grade syringes that we can fill with water. Mm-hmm. Sometimes we mix a little hydrogen peroxide in there.
Yep.
And you can squirt that in an ear and blast it out, irrigate it out.
Yep, irrigation.
And sometimes it's not even a medical grade syringe. Sometimes they have a little tube at
little
a doctor's
syringe.
Yeah, a little something that they can flush it out. And flushing it out's one way. That tends to be the hardest on people.
Yeah.
It's my least favorite way, because you're going in blind, you're blasting it in, and it's not comfortable. Second way, we have little vacuums.
Yeah.
The vacuums are kind of fun. You can get in there, and now with the vacuum, we use surgical otoscopes, which means as we're looking in an ear, we can also watch what we're doing. And the little end of the vacuum can get in there, and if it's soft wax, you can just vacuum it out.
I love that.
But my favorite way, and I think probably your favorite way, is we just have tools. We have tools look like a little mini crochet hook called a curette.
Yep.
We have little tweezers, but they're on the end of like a little handle.
Almost looks like a little alligator coming out.
Alligator, yeah, it's fun.
It's kind of fun.
But those little tools, also we use the surgical otoscopes, and you can watch what you're doing the whole time.
Right.
Definitely an art to that, but I think that's my favorite way to do it.
Yep. On occasion, if the wax is super hard, we'll just send them home with a softener and let them soften it, and then they come back a couple days later and we can suction it out. So
we've seen lots of weird things in ears, but mostly what we see is earwax.
Okay, everybody, we so appreciate you watching the video today. If you've liked what you've seen, please like it, subscribe to our channel. It means the world to us, but it also means the world to other people who are trying to figure out what's going on with their hearing health. So thank you for watching.